Welcome to the London Free Press Podcast. I'm your host, Rachel Gilbert. The number of COVID-19 deaths in London Middlesex last year was higher than any other year during the pandemic. So why aren't alarm bells ringing about it? Is public attention on the virus waning? Meanwhile, London's emergency rooms continue to operate at overcapacity. So a new clinic opened this week for children. And today I'm talking with London Free Press health reporter Jennifer Bieman to get our COVID update. Hi, Jennifer. How are you?
I'm fine, thank you. How are you?
Good, good. Let's talk about the number of deaths so far this year. Just explain, how do we have more deaths? Well, I don't know how, but explain that we do have more deaths in 2022 is what we're talking about than 2020 or 2021. Is that right?
It is true. And it was sort of a stat that our editors looked at and thought, wow, that can't be right. But it is. It is. We had a really bad January. I don't know if you remember back in January of 2022 with the Omicron wave. It was really fast and furious. There were a lot of outbreaks in care homes. That was kind of the month where a lot of deaths happened, but they still continued through the year. Um, After Omicron, COVID became really, really ubiquitous. It was so easily transmitted. It was kind of everywhere. And a lot of the public health protections that were kind of preventing or trying to mitigate or other waves were sort of, lessened through the spring and summer and fall of 2022. So we did see quite a bit of COVID spread. And that's really when you see these things kind of exploit the most vulnerable pockets of our population and kind of lead to some bad outcomes there.
Right. Do we have a percentage, or do we know numbers maybe of how many more people died in 2022 than in the previous years?
Your
It
test
was a significant amount though.
really was. You're testing my memory on it, but we were in over 200 deaths in 2022, which was quite a few. The one thing that we do know from public health is that a lot of these people were very vulnerable to begin with. So they're in care homes, they're older, they're seniors, they've got a lot of comorbidities, a lot of things that are working against them certainly. And then when COVID comes along, it's a contributing cause to their death, if not the immediate actual pressing instant cause. That's
Sure.
different than other waves of the pandemic. I know, thinking back to 2021, COVID was mowing down, 50-year-olds, people, in their 60s with a lot of life before them and really otherwise healthy people. And so
Mhm.
that was kind of the pre-vaccine era. And now COVID has transitioned to this sort of thing that's still a danger to quite a few people, but
Mhm.
mostly are more vulnerable people.
So now we're getting these deaths because it's the more vulnerable. Why aren't we hearing about this? Like if this was 2020 or 2021, there would be alarm bells all over the place. But now, has our interest or attitude towards the pandemic waned a bit? Has it changed so that we're not really focused on these numbers and stats like we used to be?
Well, that was really the focus of one of my recent stories. I spoke to a bioethicist here at Western, Maxwell Smith. He's also was on the kind of the COVID table ethicist board thing for the province when they were going through all these vaccine rollout ethics questions. And he was saying, this was a predictable trajectory, if not a unfortunate one. Certainly, we don't want to marginalize the vulnerable even more. But when diseases become more of a threat to marginalized or vulnerable people, but less of a threat to people who are privileged, healthy, able-bodied. Interest does start to wane. And he said he'd seen this in other diseases, and it's unfortunate it's happening here, but it's a decision and sort of something we should probably keep in mind is that, while COVID generally is less of a threat to people like you and I who are younger, healthier, vaccinated, all that kind of good stuff. It's
Mhm.
still a threat to some people. And that's really kind of the unfortunate bit about it is that deaths are still happening. It's still a threat to certain populations, certain people. Um,
Mhm.
the buy-in early on a lot of public health measures to protect everyone all the time, and that kind of thing was really quite large. But as the pandemic's gone on, public acceptance and sort of interest in those broader mitigation strategies also seems to have waned. So that's kind of
Sure.
where we're at now,
More people are immune. We've been vaccinated or we've had COVID, and
or
yeah,
both.
interest or both. Yeah,
Yes.
exactly. Is there something that the experts think we should be doing to protect the most vulnerable of us still? I know a lot of the measures have gone away, but do they think we should be bringing some back?
Maxwell Smith in the story was saying, we don't necessarily need to lock everything down. That's not what we need. We don't need to go all the way on this, but there there could be things in public discussion about mitigation strategies such as masking or other things like that that don't really have a giant cost, but
Yeah.
could help. So there are ways that certainly there's room for discussion here about ways we can kind of help protect the vulnerable as much as we can, while still kind of carrying on with life as usual. Because certainly, that's kind of where we're at right now with COVID. It's, kind of around, and it's gone to kind of a personal responsibility to protect yourself. But,
Sure.
a lot of vulnerable people could try to do everything right and still get it just, because they're vulnerable.
Absolutely. I did, along with that, I found this quote fascinating in your story from Maxwell Smith. The move from collective responsibility for reducing COVID spread to a personal responsibility shifts the burden entirely to the most disadvantaged, to those people who are most at risk, which I find fascinating and so sad at the same time.
Yeah, but that's the trajectory of other things too, right? Like,
Sure.
other diseases in the past have gone that way too. So it's kind of, while it's a predictable trajectory for COVID to take, it's one that
Mm-hmm.
certainly we should be aware of, definitely, about, what that it is still out there, that it is still a risk to people, and maybe there's things we can do to help mitigate that risk.
Yeah. Talk about COVID now. I mean, we are hearing about new strains every now and then. I believe there was just a new one that was in the news recently. We've been talking about. Are we is it less severe? I mean, it's still out there. I feel like personally it's going to be around for a while. Um what do you think? Is it less severe for us now?
Well, COVID is with us. It's going to continue to be with us. We're tracking variants very closely. And this one is the Kraken. It's got a very fancy,
Yeah.
XBB kind of title to it, but the Kraken is kind of its little nickname. And, it's showing up in Ontario. It's very, from what, researchers, people have said, it's very, very virulent. It'll definitely, or transmissible. It'll definitely spread quite a
Mm,
bit. It'll be interesting to see how it plays out. And it may become a dominant strain here. We're in a different position than we were in the early days of the pandemic. There's a lot of vaccination, a lot of booster uptake. We have an Omicron specific booster now. And
right.
again, like you've said, a lot of people have had COVID. A lot of people have been infected in addition to being vaccinated. So we've got a population that's a bit more used to COVID now.
Sure.
Um, I don't know that I'm not living in fear of Kraken. I guess that would be the way to put it. I think that it's we need to manage it and mitigate it and make sure that it doesn't really exploit our most vulnerable people and lead to a lot of problems and severe outcomes for those people. But it's one of those things, right? The COVID's going to continue to mutate. There'll be new ones that come along. So far, I'm not seeing experts really going crazy about this one. It's an
Mhm.
Omicron strain, like a subvariant, and Omicron has generally not led to as many severe outcomes as Delta or even Alpha,
Sure.
generally.
Sure. Let's talk about emergency rooms because we know, and we're shifting a little bit because we know that emergency room wait times in London and everywhere, really in Ontario, have been extraordinary, right? But now there's a new assessment clinic that they've opened. Well, it's been open since December, is that right? But now children are able to go. So just explain what this new clinic is, how this is going to help the ERs.
Yeah, so the old assessment center at Carling Heights Community Center moved to Victoria Hospital's Building 24 in like the fall. And we
Okay.
gave the community center back. In December, they switched it to be not just a COVID place, but a place you can go for flu or colds. If you have a running nose or a fever, you can go and be assessed there, which is great because it means that people that are feeling unwell, that can't get to their family doctor, don't have a family doctor, have a place to go that's not the ER. And it's been
Right.
really quite successful with adults. So for that whole month of December, they were doing adult appointments for the cold COVID flu clinic. They can do treatment there with Paxlovid if you have COVID and are eligible for that antiviral drug.
Mm-hmm.
And now it's open to kids, which is really, really important. So it's no surprise children's hospitals this fall have been really pounded by flu and RSV and COVID as well. Just a lot of respiratory illness going around. It came really fast, really early. And it's not being great for children's hospitals in London and around the province.
Mm-hmm.
So the idea here is that, a kid that might have a fever or runny nose can go to this clinic. It'll keep them out of the ER. And that's kind of, that's the hope. So they've got Mondays and Wednesday appointments now. They're willing to and able to expand them if there's a lot of demand, but it's by appointment only, particularly for kids that don't have access to primary care or are at really high risk for severe outcomes.
Sure. Is it so? Sorry, you said it's appointment only, so you can't just walk in.
Not right now. No.
And where do you make an appointment for that?
Well, there's online. I think it's COVID vaccine testing, LM, something like that. It's in the story. But yeah,
we'll
it's
check out. Well, obviously, we'll check out the story.
Yeah, online in advance. You can also call too. And it's Monday evening and Wednesday evening appointments for kids. If there's about 25 spots each day, but they're looking to expand potentially.
Absolutely. Okay. Well, thank you so much for joining us. We'll check out your story for sure on lfpress.com so we know how to make appointments at the new assessment center, which is now open for children as well as adults. Thank you, Jen, for joining us today. We're going to be following your stories on lfpress.com. Thank you.
Thank you.